Talking about people infected with Lyme disease now in the UK, and they've had to wait up to 30 years, or some have had to, for correct diagnosis. This is according to a new study.
Yeah, researchers have found that the condition is so poorly understood by healthcare professionals that NHS services only correctly identify the disease in about a quarter of cases. So what is it exactly and how do people get it?
Well, it's a bacterial infection that's spread by infected ticks, and according to most recent figures from Public Health England, cases in England and Wales tripled between 2003 and 2013.
Yeah, there are also up to 300 cases reported every year in Scotland and a number in Northern Ireland, but it's believed the real figure is much higher. Now, NHS England estimates there are about 2,000 to 3,000 new cases in England and Wales every year.
So we're joined in the studio now by Dr. Chris Newton, who's going to clear up some of good morning, some of the theories around this, and is one of the research scientists who carried out that study. And we also have Demetrios Loukas, who's a former school teacher who contracted Lyme disease in 2005. Demetrios, many thanks for joining us this morning. Just tell us, we explained how it's transmitted, what happens, but what happened to you when you contracted the disease?
Well, during my teacher training back in 2005, I took the children on a school trip to a farm, and it was, I believe, the bite happened during that trip, and I experienced fever-like symptoms, and I developed an abdominal rash, and I presented myself to my GP, who, at the time, and not my current GP, who prescribed an antifungal cream. But that was obviously the most inappropriate treatment. I should have received antibiotics there and then.
So you were prescribed that cream. You took that cream.
Yes, of course.
And then what happened? When did you realise actually this isn't working?
Well, I immediately after the bite, after the episode of the fever and the abdominal rash, I began to develop all sorts of infections, from sinusitis, prostatitis, Helicobacter pylori, gastritis, and that went on for a few years, and then I started to develop neurological symptoms. All sorts of things, from depression, hallucinations, memory loss, and then eventually it worked its way to my heart, and I developed a heart block, an arrhythmia, and then
this was a process of years.
Yes.
And then who diagnosed you then? And
eventually, I crossed paths with an NHS electrophysiologist cardiologist at King's College Hospital, who saved my life. Because if it weren't for his clinical diagnosis, I wouldn't be here. The test was negative. That's the problem. The test the NHS test was negative, but he was aware that the test was unreliable.
Let's talk to Dr. Chris Newton, because it's a shocking story to hear, but these figures suggest it's not that unusual in people who suffer it, for it to go undiagnosed for a while.
I think the problem is that it's a very difficult diagnosis to make, and we were just discussing this earlier, that the GP has 5 minutes, maybe 10 at most, to make a very, very complicated diagnosis. The symptomology crosses over with so many other conditions. I mean, the survey we've done really was to look at the response that the patient had from the GP and also the private sector. And the initial diagnosis that's made often is chronic fatigue syndrome.
Could Demetrios or somebody in the early stages have a blood test that would clarify right at the beginning it is or isn't Lyme disease?
Usually you use the blood test to support the diagnosis. The problem is the blood test is not that reliable. The estimates are anywhere between 20 and 60% of individuals that present that really do go on to get proven to have Lyme disease come back positive. So we need really a new test that's a lot more sensitive.
Is that likely? Is that research underway?
Well, this is part of the reason we've made this study, to try and raise the profile of this and to say, look, this is what it's costing the country. Back of the envelope calculations, looking at this, the money lost in tax and national insurance just from these people amounts to 20 million. You're looking at, for hospital visits, you're looking at up to $1 million. You're looking at just scans, high-resolution scans, $500,000. Now, we're trying to convince the government that we need to put money into this to save that kind of money. We're looking for maybe $500,000, $1 million to look for new testing. basically.
How are you now, Demetrios?
I'm improving, but just
Do you still have it? You still have
Yes,
Lyme disease?
I still have.
It doesn't go.
It can go. You know, we're working with one of Europe's leading Lyme disease specialists, Dr. Armin Schwarzbach, and he's been treating me with my NHS GP, who's been incredibly generous and understanding, but he can only prescribe so much because I don't have that positive blood test. But going back to what Dr. Newton was saying in 2015, in June, thanks to Sir Simon Hughes, who was my previous MP, my current MP is Neil Coyle, who's been back in this campaign, we were invited to the Rare and Imported Pathogens Laboratory, where we met with the Chief Clinical Officer there, Dr. Brooks, Tim Brooks. And during that meeting, that 6-hour meeting, he confirmed and agreed that the current diagnostics used by the NHS are not totally reliable. He explained that they did not have the funds to invest in research and development. He said that, you know, NHS clinicians should not be excluding a clinical diagnosis of this disease based on a negative blood test. He offered to remind NHS clinicians of this fact. We don't know if this has indeed happened, this reminder, but NHS clinicians are still turning away patients with Lyme-associated symptoms.
I'm afraid we're going to have to leave it there for now, but you certainly put it out there this morning and got the message across. Thank you both indeed. Thanks very much for coming in.
Thank you.
Pleasure.